Today, we're here at Royal North Shore Hospital, and I'm joined by the Health Minister, Brad Hazzard, Dr. Kerry Chant, the Chief Health Officer here in New South Wales, Susan Pearce, the Deputy Secretary of New South Wales Health, and Dr. John Vasiliadis, who is the Royal North Shore Emergency Head here, who looks after our interns, which we have an important announcement today. But can I begin by thanking everybody right across our state for Australia Day yesterday? And it was great to see so many people out across New South Wales celebrating in a COVID-safe way and enjoying the sunshine and the best that New South Wales has to offer, and really appreciating and celebrating our great Australian values. I particularly want to acknowledge today the two people from New South Wales who won those important Australia Day awards. Firstly, Dr. Daniel Nua, who won the Young Australian of the Year, who actually works right here, is working today in ICU at Royal North Shore Hospital, and the work that he's done with street side medics really, I think, embodies the great spirit of service of our country in the work that he's done, going well and beyond setting up those clinics, going out to people who are sleeping rough across the streets of Sydney and providing that medical care and support. And they're the values, I think, that really embody everything that's great about Australia, particularly here in New South Wales. And also the Local Hero of the Year award from New South Wales, Shana Wan, who has done incredible work in reaching out to people with alcohol addiction in regional New South Wales, helping them overcome that addiction. And I think those awards right across the board and for all those winners really demonstrate. I think it's very pleasing to see we're kind of moving away from celebrities and actually having people who win these awards who really share those great values, spirit of service, generosity. And those two award winners in New South Wales are well deserved, and I'm sure they will use their platform over the next 12 months to not just promote their work, but instill that spirit of service in others across our great state. Can I also thank our health workers not just for the work they've done over the last 2 years, but particularly yesterday on Australia Day, while many were out celebrating and enjoying the day. Our health workers right across the state were providing that care and support for people who needed it in our health system. Our teachers as well, who were preparing for the school term, which in the main commences next week. They're doing an amazing job as we start the school term in a different way that we had in the past. But I really want to thank them for the work that they're doing in preparing for the educational year for our kids. Obviously, we've made that strong commitment to get kids back in the classroom in a safe way on day one, term one, and our teachers are working incredibly hard to get that school year off without a hitch. And I can say today that we've already had 80% of schools, so 4.9 million rapid antigen tests have been distributed right across our state. It's 80% of schools have now received them. It has been a military operation. The Department of Education, New South Wales Health, the Department of Premier of Cabinet have done a great job in ensuring that we've had those tests distributed, and I want to thank them for the work. And I want to once again say to parents right across the state that we will ensure that we have a safe environment on day one. I know many parents are anxious, but it's incredibly important, as we've said numerous times, for our children's educational outcomes, mental health and social outcomes to be back in the classroom. And I'm very pleased with the work that has been done right across the state to ensure that we can have kids back in the classroom day one, term one, in a safe way for teachers, children and parents. Today we're announcing a record amount of interns that are starting in our hospitals right across New South Wales. Over 1,000 interns are currently doing their orientation. The Health Minister and myself were able to meet and welcome some of those interns here at Royal North Shore today. There's never been a more important time to have more interns on, and we're also seeing a record amount of interns in regional New South Wales as well, with over 162 of those over 1,000 interns in rural New South Wales, and many will go over the course of their time as interns to other hospitals around the state. We met some today who are going up to Port Macquarie, others going out to Ryde, but they're incredibly excited to go. Just concluded their study, but to see so many interns coming into our system at a record amount, more than any other state or territory, is incredibly pleasing. And I want to thank them for the work for all the work they've done in terms of getting through their course, but ultimately as well the work they'll do in our health system over the course of their careers. And there could be never be a more important time for their careers as doctors to begin than where we sit today. In addition to that, the other point I'd like to make is, well, obviously that's on the back of the substantial investment that we've made in our health system here in New South Wales. Tomorrow we'll release the modelling, as we do every Friday, in relation to where we sit in respect of those scenarios that we've put out. We're currently operating within capacity, and where the hospitalisations and ICUs remain stable, and that's incredibly pleasing and reassuring. The final point I'd want to make today is in relation to booster shots. We have substantial capacity for booster shots right across our state. And I note that there were some reports today that some of those booster rates were low, and implication being that supply was not available. Well, that is not true. We have substantial capacity to provide that additional support to our GPs and pharmacists when it comes to receiving a booster shot in New South Wales. At the moment, we have capacity for an additional 100,000 every week for people to come forward and get a booster shot. We're currently sitting at around 40% of people who are eligible for a booster shot had received one. So can I say to everybody across the state, if you have not made a booking, please come and do so. If you're unable to get a booking through your GP or your pharmacist, we have 40 hubs across the state able to administer that booster shot. So there's a lot of capacity in the system. We want to continue that drive. As we've moved that date forward from 4 months to 3 months from the date of your second dose vaccination, many more people across New South Wales are now eligible for that booster shot. And I ask you to please come forward and make that booking. We know from the evidence, it's very clear that vaccination has been key to keeping people safe, to putting downward pressure on the hospital system here in New South Wales. And we really need to get that booster shot vaccination rate up to where we have those first dose vaccinations. So there's opportunities right across our state, 40 of our hubs. So if you can't get that appointment, which many people obviously prefer to have that booster shot administered through a GP or a pharmacist, we have a lot of capacity in our system for those bookings to be made. As Dr. Kerry Chant outlined earlier in the week, if you've had COVID, you can receive your booster shot within 4 to 6 weeks. So once again, please make that booking. Dr. Chant will provide some further information in relation to that. But boosters are key to keeping you, your friends and your family safe. We want to do everything we can to continue the sustained effort over the last 2 years. I know many people are tired and over COVID, but we have to do this final push to get us through this period of time. I want to continue to thank everyone for the efforts and sacrifices they have made over the last 2 years, but particularly during this period of time. We are doing well. We are seeing a stabilisation, hospitalisations and ICUs. We've been able to keep society open, living alongside the virus. There's been inconveniences for many people, but we're doing well as a state, we're doing well as a country. But if we can continue that sustained effort to continue to go out and get boosted, that will ensure that we all stay safe as we move through this next period of time.